My role, as outlined by the chairperson, is to encourage the champions. Encourage those champions to themselves get tested, but then to encourage them to get those who are associated in the groups in which they are to be tested as well. I think some important data was provided by Mrs. Gardiner Destin Richardson. And one of the things that it suggests to me is that more women get tested and more men die, which means that there's a correlation between testing and the opportunity to live longer. And so men, us men, need to be a champion, be champions for getting tested so that we can mirror the same examples as the women. When I became the minister, I learned in greater detail of the work being carried out by the ministry headed by Mrs. Gardiner Destin Richardson. I learned of it not really so much from Gardiner Destin Richardson and her team, but from others in the region who seem to look up to the work being carried out in St. Kitts and Nevis. And it is a testimony of the work done by Gardiner Richardson. I think we should give her a big hand for that. Sometimes we don't do enough to congratulate the people who work hard and to encourage them to continue to do the work that they do. I want it to be on record this morning that I acknowledge that this program for HIV testing and HIV work in St. Kitts and Nevis is one of the bright lights of the Ministry of Health. I want to take a moment to read a few passages, paragraphs from what PAHO has offered us. Dr. Shreb sent us that message, and I may read. Knowing HIV status is vital to accessing prevention treatment, ensuring follow-up, protecting future partners, and avoiding new HIV infections. He continues, 1 in 4 people with the virus in Latin America and Caribbean do not know they have it. Now that is a revelation which seemed to have borne itself out in the presentation made by Mrs. Richardson this morning. And so PAHO is calling on people to get tested, and so too is the Ministry of Health in St. Kitts and Nevis. Get tested. It is an important step towards halting the spread of HIV and ending AIDS. Know Your Status is a campaign slogan for this year's World AIDS Day. And of course it was celebrated on the 1st of December. HIV testing provides people with a unique opportunity to discover their HIV status and enable those diagnosed with HIV to rapidly initiate life-saving treatment. It also serves as a gateway for those at higher risk of acquiring the virus to access the recommended package of prevention services in order to remain negative. Not negative in attitude, negative in terms of what your status is. It is said that there are over 2.1 million people living with HIV in Latin America and the Caribbean, 1.6 million of whom know their status. The difference, which is a high number, do not know their status. And while much work has been done, despite all of that progress, the rate of new HIV infections remain unchanged throughout. which means that we have to pay attention, closer attention, to the level or the sustained level of infection which is taking place in Latin America and the Caribbean. The majority of new infections is said to be in gay men and other men who have sex with men. It seemed to be suggesting that some 41% of new cases in Latin America and 23% in the Caribbean is as a result of that. And so this morning, I want us to recognize, while we are recognizing the work of Ms. Richardson and her team, and she named the other two members of her team, that we highlight the fact that AIDS, we learned about it in the 80s, and there's almost a casualness even today, some 30 odd years later, about understanding, I will say the population understanding AIDS and the realities that occur if you are found with AIDS. I remember, for example, I think it was in the 80s, when Magic Johnson announced that he was HIV positive. People thought it was a death sentence. But today, when you look at Magic Johnson, some 30 odd years later, it would appear, and it suggests to us, that with the right treatment, with the important intervention, we can continue to live our lives and avoid having other persons infected because you know of your own status. Last year, I remember hearing from Mrs. Lucine Pemberton. I know her married title now, so she is now Vaughan. I remember hearing her saying that they had set a target for testing of about 1,000. And that was not satisfactory to them. And they went on a rigorous tour across the country and hit a target beyond 2,000 or near 2,000. That is a significant achievement. And I also remember Lucine had worked so hard last year that she herself got sick, not with HIV, got sick from all of the efforts that she put in. And she did not even realize it. I remember her story. She said, I took my daughter to see the doctor. And when my daughter was having her test done at the doctor looked at her and said something. And she said, well, why don't you let me examine you to see if something's wrong with you. And there and then she found out that she was in a situation which was near fatal, so to speak, and had to be rushed out to get treatment. Lucine, I thank you for your work last year. And I pray that while I would want to see you perform as well as you've always done, that you don't overwork yourself. Say it again. Last year we also achieved this important milestone of the eradication of HIV and syphilis in the Federation of St. Kitts and Nevis. That is a significant achievement. We were among the first. What that shows is that from a clinical standpoint, our clinicians in particular seemed to have achieved a significant goal, treating those parents who are pregnant so that in the end we do not have children being born with HIV. We continue to build out our infrastructure in the Ministry of Health regarding all diseases. I'm sure you're aware that we introduced, for example, a mental health facility, because we are paying attention to all aspects of health. I'm sure you're aware that we installed a chemotherapy lab, a chemotherapy production area so that we can treat persons with cancer. I'm sure that you're aware that we have introduced a program, a 3-year program for identifying those at risk for kidney diseases. And I'm sure that you're also aware that it was only last week that 3 hemodialysis machines were delivered at the JNF hospital to help us to work on persons with chronic diseases, to interdict. This program in particular, if I should expand on it a bit, helps us even at the point of service at the clinics, at our health centers, to identify when persons are at risk for kidney diseases and to interject early and to begin treatment. But those 3 that I just mentioned are really not the trailblazers based on the information I have. The trailblazer was those working on HIV and AIDS. So those departments of the ministry learned from those who are pioneering on AIDS. And so I want to take this moment this morning to encourage all of our champions, all of the persons who are in groups, those who lead groups, churches, schools, basketball, football teams, those who are in leadership positions, while they themselves should get tested, they should encourage those who are in their teams and their organizations to get tested themselves. Knowing your status helps to prevent the proliferation of that disease. Knowing your status can help you to continue to live a longer period in this world. And even though you might be HIV positive, I will say living longer healthy. Knowing your status is an important step for you living a longer life, a sustainable life. And so I encourage all of us to get tested. I've done that 2-3 times already for this decade. Not because I'm living a life that is open to getting HIV, but it's important to know your status. As we embark on universal health in this federation, it is even more important that we know the profile, our health profile in St. Kitts and Nevis. We get a closer look at our health profile, understanding what we're dealing with. Because embarking on universal health is, while it is one way of helping ordinary poor people to access care that they would not ordinarily be able to afford, embarking on it will ensure that they do not get bankrupt. Embarking on it helps us to make our health care services more attuned, focused on the tasks that we have ahead. Embarking on universal health care is an important mission, not only for we who are in government today. It was a mission which was discussed by the previous administration. And I'm aware had already written a proposal for the commencement of universal health care. But I do not at this point want us to think that universal health care is the answer to the will-all, is everything to our health care. Because that is only coming at the end. I want us in our country, our clinicians, our doctors, to promote healthy habits, healthy lifestyles, before we get to the point where universal health care has to be forking money out to deal with the chronic end of these diseases. People drink too much liquor, eat all kinds of nonsense, spend so much money making their bodies sick, and then when we get to 50 and 60 and 70, we're finding ourselves spending all kind of money to live long. And so from early, we must get into our schools and educate our children about their lifestyle. You're eating, your lifestyle, you're eating too much, you're drinking too much, and you're sexing, maybe not too much, but badly, without protection. And so while we are doing these things, I want us to pay attention to these things, what we eat, what we drink, and protecting ourselves while we are relating with each other intimately. I therefore, at this point, call again on all our champions, all our leaders of groups and organizations, those of us who are in leadership in government and opposition, to encourage those who associate with us to know your status, get tested, so that we can continue in this country to keep the cost of health care down. Thank you very much.